Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Welcome back. This episode, we want to take a look at the mental health and well-being of men. So this episode is going to be all about men, what the research tells us regarding the things that they specifically struggle with, or things they struggle with more than women, what we know about how men seek support and treatment for their mental health, and the barriers that exist from men feeling empowered to seek support. And then finally, how can we start to change the negative stigma that exists that can keep men feeling alone, isolated, and stifled from asking for help and support when they need it most? According to the National Institute of Mental Health, the prevalence of some mental disorders is lower in men than women, but then there are others like ADHD that are diagnosed at a much higher rate in men. In the data regarding suicide statistics in the United States that was published by the Center for Disease Control for 2021 and 2022, it was reported that in 2021, the suicide rate among males was 4 times higher than the rate of females. So 80% of suicides were males in 2021. And what the National Institute of Mental Health says is that research is just now being done to look at the biological and psychosocial components that affect mental health and specifically the mental health of men.
That is really fascinating. And it's been a long time coming. Men really are in need of some mental health prioritization. And I think there's a lot of factors that go into the sorts of barriers men face when it comes to getting that kind of help. But in 2024, I think it's time to put the men in mental health. In fact, Mental Health America says that 1 in 10 men experience depression or anxiety, but less than half of those will actually seek treatment. Several mental health organizations point to the stigma that exists around men seeking treatment or speaking out about their mental health or emotional struggles as a possible barrier to men accessing treatment and support. There's also immense pressure that men face to just tough it out, and getting treatment is often seen as a weakness rather than a strength. This unfair stigma helps to perpetuate this negative perception that a lot of men have about seeking treatment and support. So, when we look at the data regarding depression, for example, it is a real concern. According to the American Medical Association, the data about depression in the US shows that women suffer from depression more than men do. But yet, the suicide rate for men versus women is 3 to 4 times higher. While you can't say definitively that all of these men who committed suicide were suffering from an undiagnosed depression, we can't overlook that depression is a major risk factor for suicide. And another interesting thing that this particular article brought up is that the way that our mental health diagnostic criteria surrounding depression specifically could possibly be geared more towards how women experience depression, which really goes back to the research that you mentioned earlier. It's finally being done to look at the biological and psychosocial components that affect mental health for men specifically.
Yeah, this was a very interesting episode to research because there's a lot of different things being done that in the field of mental health that specifically look at how men experience mental health issues and how it's so very different. So it's interesting to think about why are there so fewer men diagnosed with depression, but yet the suicide rate for men is so much higher than women. And obviously we can't solve that during this podcast, but I do think it's really worth exploring. But if you look at several mental health disorders and the history of mental health, many of those were seen as afflictions for women, that mental health was like a woman's issue. So it is possible that what has happened is that they've kind of taken the experience of men out of mental health issues. And through doing that, we've also ostracized them from even feeling like they can seek help or even thinking of that as an option. So if we're looking at the way women typically experience depression, and that's what we're talking about in the media, that's what we're discussing and promoting so that people know, if this is going on, seek help. It's pretty reasonable to think that a man might look at what's going on and what's being said and what he's feeling and going through and just think, well, that doesn't fit me. So I guess I'll just figure it out on my own. I'm not sure what to do.
Mm. Yeah. Well, and then you pair that with the stigma men have around just talking about things like feelings and what their experiences are. And I think it goes a lot to just kind of shoving what's going on with them internally kind of under the rug. And yeah, that whole, well, I'll just figure it out. I'll tough it out. This expectation that's carried of needing to just tough it out rather than address it. But there's data from an analysis study about the experience of symptoms of depression in men versus women, and it stated that men reported higher rates of angry attacks or aggression, substance abuse, and risk taking compared with women. And when they included those criteria as symptoms of depression, they actually found that a higher number of men met the criteria for depression than women. So, the conclusion was that when you include alternate symptoms along with traditional symptoms of depression, the differences in the prevalence of it are eliminated, which is really interesting because if that's the case, if we change the criteria of depression and we start pushing that information out to the public, when more men realize that what's going on with them is possibly depression, and maybe that would start to remove some of the barriers that prevent them from feeling comfortable seeking treatment.
Well, interestingly enough, there was another study that looked at very similar things. And what they concluded was that one way we could capture and properly diagnose men who are dealing with depression, but may not name that as a primary concern when they actually come to their medical provider, is to administer gender sensitive depression inventories, especially to men who are exhibiting the male typical symptoms, but they don't even discuss anything that might point the provider to depression, like sadness or, loss of interest, all those types of things that are typically seen with depression. So, if we look at what the Mayo Clinic says are some depression symptoms that are typically experienced more by men, men can feel sad, hopeless, empty, just like what's typically experienced by women. They can also feel very tired or have a hard time sleeping, alternatively, sleeping too much. And they can also not get pleasure from activities that they're usually enjoying. Those are all typical symptoms of depression. But there's some other behaviors that could indicate that a man might need to be evaluated for depression, such as problems getting along with others, including your spouse or partner, escapist behavior like spending a lot of time at work or on sports, physical symptoms such as headaches or digestive issues and pain, problems with alcohol or drug use, violent behavior, irritability or extreme anger, and risky behavior such as reckless driving. And all of these could be due to other mental health issues as well, or even a medical issue, but they definitely also overlap with depression and are just an indication you might want to get some support. The Mayo Clinic also lists a few reasons why men with depression aren't often diagnosed. One is not recognizing that it's depression. And that can be because of the idea that if you're depressed, you only feel sad or emotional, but feeling isolated and seeking ways to distract yourself from feeling emotions is also an indicator of depression. Another reason is downplaying symptoms. Maybe you don't see how much your symptoms are affecting you, or you don't want to admit that you need some support. So, not everyone is taught how to openly talk about their feelings. And in fact, some are punished for it as children. I feel like more so men than women, or boys than girls, I guess. So it makes sense that it would be something that men might struggle with. And the last reason that they cite for men being underdiagnosed is not wanting to get mental health treatment. And I've heard from men and women that, therapy is a scam and you should be able to deal with your own
Mhm.
problems. But it's that stigma that keeps people from getting help and getting better when they need to and keeps them stuck in something that's unhealthy and sometimes even dangerous for them.
Yeah, that is such a great point. It's interesting when we think about like medicine as a whole in the US, so much research, so much of the protocol, the testing, everything has been done using, males, typically, right, heterosexual white males, a very particular demographic to validate what we do in medicine, right? But it's just so fascinating that mental health seems to be kind of escaped out of this realm, right? And it's really left men hanging in a lot of ways. Actually, a review done by Frontiers in Psychology looked at a handful of male tailored psychotherapy approaches for depressive disorders. What they found was that male specific psychoeducation programs and psychoeducation texts could help to reduce the negative effect as well as the shame that men experience for needing treatment for depression and for the symptoms of depression that they experience. And male tailored psychotherapy programs may increase the effectiveness of therapy, including how engaged men feel in it and how likely they are to even continue the treatment. The Newport Institute says the five most common mental health disorders in men are depression, which we've covered, anxiety, and the types of anxiety disorders that are seen more commonly in men are panic disorder, obsessive compulsive disorder, generalized anxiety disorder, social anxiety, phobias, and substance use disorder is the third type most common in men. PTSD, post traumatic stress disorder, is the fourth disorder. Bipolar disorder is the other one that's most common in men. Now, NPD, or narcissistic personality disorder, may occur in up to 5% of the US population. The good news here is that all of these conditions can be treated with medication or psychotherapy, but you gotta get in the door. Men, let's make this a year of healing and getting in the door.
It's interesting because I like the TikToks and there is actually a podcast where it's two male friends basically talking about their experience, like working through their traumas and things. But it's very interesting because they'll have conversations about what's actually happening in their brain in a way that I haven't heard a lot of men talk about things like one of their conversations was, well, if you tell me that you're upset with me, I need you to talk about it right then. And then the one guy's like, why? I don't need that. Like, just tell me you'll come back and talk to me later. He's like, no, because I'm going to be anxious and all these things. And so it's really kind of refreshing to see them kind of lean into it. And the one guy has like a girlfriend and he'll say, this is how we'll handle conflict. Like if I get upset about something, I'll go to her and say, I'm upset about this, but I don't want to talk about it right now. And then she's very good and she'll say, okay, what do you need from me? And I hear you and whatever. And just the whole thing. And I've seen other podcasts where men are talking about pain from their father relationships and things like that. And I'm hoping that this is the year that more men start really taking charge of their mental health and realizing that I mean, being vulnerable is one of the, most courageous and bravest things you can do because it's uncomfortable. And there's that fear of, am I going to be rejected or ridiculed or whatever it is?
I think that's a great point. Vulnerability, I think all around, men and women, I think vulnerability is often cast as a weakness in our culture. And it certainly flies in the face of what we might historically consider to be like strong, successful, whatever, all of those sorts of things. But really, vulnerability, like you said, it's a true strength. And it is it is required of the healing, right? It's required part of the journey.
The other thing about vulnerability is it's not just required for your own healing, but it's also required. There's only so close you can get in relationship with others if you're not vulnerable, especially like in your romantic relationships.
Mm-hmm.
So
Exactly.
hopefully this has been helpful. Hopefully, the research will continue to look at ways that awareness can be spread to men in order to reduce the negative stigma about mental health and seeking support and treatment, as well as ways that treatment can be adapted so that men are able to engage and stay with treatment once they actually seek it out. And I think it's an important thing that should be addressed in mental health in general. I also hope that we are able to model better for our young men that it's not only okay to have emotions and express them, but it's actually the healthiest thing they can do. Maybe in 10 or 15 years, we'll be in a different place and mindset with better support and outreach for the mental health of men. We hope that this information was helpful. All of the research that was used in this podcast episode will be in the show notes. If you have questions for us, suggestions for topics we could cover, or any feedback, you can email us at dhbhs.media@hitchcock, and that's HITCHCOCK.org. If you haven't subscribed, please do so. And if you've enjoyed our episodes, please tell a friend. And thank you for listening.